In the field of pharmacology, the concepts of potency, efficacy, and affinity play pivotal roles in determining the effects and therapeutic potential of drugs. These fundamental pharmacological parameters are crucial for drug development, dosage optimization, and the overall understanding of drug actions. In this essay, we will delve into the definitions, differences, and significance of potency, efficacy, and affinity, shedding light on their intricate relationships and applications in the world of medicine. 1. Potency. Potency refers to the measure of the drug's activity in producing a particular effect at a given concentration or dose. Essentially, it indicates the drug's strength or ability to elicit a response. The more potent a drug is, the lower the dosage required to achieve the desired effect compared to a less potent drug. The concept of potency is not related to the intensity of the effect but rather to the amount of drug needed to produce a specific response. Potency is often quantified by comparing the drug's dose required to produce a particular response with that of a standard reference drug, typically called a standard or reference drug. This standardization allows researchers and clinicians to compare the relative potencies of different drugs within the same class or for the same indication. 2. Efficacy. Efficacy, on the other hand, refers to the maximum therapeutic effect that a drug can achieve, regardless of the dose administered. It represents the drug's ability to produce the desired response. A drug with high efficacy is capable of eliciting a strong and clinically relevant effect, even at low doses. In contrast, a drug with low efficacy may require higher doses to achieve the same therapeutic outcome. Efficacy is not concerned with the dose or concentration of the drug, instead, it focuses on the magnitude of the response. The efficacy of a drug is determined by its interaction with specific receptors or molecular targets in the body, triggering downstream cellular or physiological changes. 3. Affinity. Affinity refers to the attraction or strength of binding between a drug and its molecular target, such as receptors, enzymes, or transporters. It reflects the degree of chemical interaction between the drug and its target. The higher the affinity of a drug for its target, the more likely it is to bind with the target when present in the vicinity. A drug's affinity plays a critical role in its potency and efficacy. Drugs with high affinity for their targets can achieve a significant response at lower concentrations, making them potent. Additionally, drugs with high affinity are more likely to remain bound to their targets, resulting in prolonged or sustained effects, increasing their efficacy. Interplay between potency, efficacy, and affinity. Understanding the interrelationship between potency, efficacy, and affinity is essential for drug development and clinical application. A drug with high affinity for its target may not necessarily be highly potent or efficacious if it activates the target poorly or triggers an undesired response. Conversely, a drug with moderate affinity may demonstrate high potency and efficacy if it effectively induces the desired therapeutic effect. Practical applications. 1. Drug development. Pharmaceutical companies consider potency, efficacy, and affinity when designing new drugs to optimize therapeutic effects and minimize side effects. 2. Dose optimization. Understanding potency helps healthcare professionals determine the appropriate dosage of a drug to achieve the desired response effectively and safely. 3. Drug interactions. Knowledge of affinity aids in predicting potential drug interactions, as drugs with similar target affinities may compete for binding sites. Conclusion. In conclusion, potency, efficacy, and affinity are fundamental concepts in pharmacology that influence drug behavior, efficacy, and therapeutic outcomes. A well-balanced understanding of these parameters is vital for drug development, dosage selection, and patient care. By comprehending how drugs interact with their targets and the downstream effects they produce, researchers and clinicians can work towards safer and more effective pharmacotherapies for various medical conditions.